Bonni, nice to see you again, even if it's online. It's a pleasure to have you for this interview for Cannareporter and Cannadouro magazine. You are a doctor based in California in the US with over 13 years experience as a pediatrician doctor. How did you decide to become a doctor? Was this like your dream as a child, or was it something that appeared later in life?
Oh, it appeared as a child when I was about 8 years old. And I think I was influenced by, believe it or not, some TV show that my father used to like watching. And I thought it was very exciting, you know, where they would bring people into the hospital and run tests. And I thought I was just very captivated by it. So I decided, I think at about age 8, that I wanted to be a physician. I didn't know what kind. And then through my medical school training, you know, they try you out in surgery and internal medicine and OBGYN. And when I did pediatrics, I knew that I had kind of found my spot. I really enjoyed that. And then I went on to train as a pediatrician, and that's actually over 30 years ago. It's just been 13 years in the cannabis world.
I used as a starting point for this interview the book you recently published, Cannabis is Medicine. And you also tell in this book the story of your mom that you discovered later in your life when you were a teenager, that she also suffered from epilepsy. How did this also contributed to the will that you had to help your mom and other people with these kind of diseases?
Well, certainly when your mother is ill, and really she put a brave face on. She took her medicine as she was instructed to take it, and she didn't really want to talk about it. I think, you know, in those days, we're talking about the 1960s, she was embarrassed by her diagnosis. And it was kind of a different world then, where now we share so much with each other to look for support and to uplift each other. Back then it was, you know, almost like a shame that you hid because it was it was considered, you know, something like akin to mental illness. But she hid it from us. And then I found out when I was a teenager. I mean, I always knew she had to take medicine, but they never talked about why, and we just didn't ask. But certainly it gave me an understanding of what someone who has a chronic condition, some of the limitations that were put on her. She wasn't allowed to drive a car for a very long time. And when she did, she only drove every now and then. And also kind of the fear of what could happen.
Yeah.
And I think that that's something that my mother, I don't know that I identified it then as that, but now looking back, you realize that when you have a serious chronic condition, life is a little bit different. It's not as carefree. And you're always wondering what's around the next corner. It's very unpredictable. And I definitely see that with the families that I work with.
Yeah, you mentioned in your book that you found out through, it was from a friend that you learned about medicinal cannabis. And you tell it a little bit as a doctor that at the time you didn't know about the endocannabinoid system. Is it still common to find doctors that they have no idea of the endocannabinoid system in the US?
Well, yes, because it's not being taught. So something like under 20% of medical schools even mention the endocannabinoid system. And this is, of course, a problem, because we know that the conditions related to endocannabinoid dysfunction or deficiency, which sometimes can be the main part of illness, or sometimes it's a consequence of the illness. But if we leave that endocannabinoid system kind of unfixed, let's say, or unaugmented, because that's really what we're doing when we take cannabis medicine, is we're augmenting the system to try to help it run better. Without knowing about it, how are you supposed to even address underlying illness? And how do you have a patient who's on their 10th medication and not doing well. And you just kind of say, well, you're intractable. We use this word intractable or refractory. Oh yeah, we can't help you. There's no medicine to help you. But yet it's only been looked at through the allopathic medical program, as opposed to kind of starting looking outside that for a solution.
Yeah, as a doctor, and your principles like do no harm, how do you see these things? Like the doctors still ignore maybe like a fundamental piece of this puzzle, right? How do you see
That's
that?
100%. And that it's we're asking people to potentially take other medication, and in the case of many of my pediatric patients with intractable epilepsy, to have a magnet installed in there, an invasive procedure. How about brain surgery?
Yeah.
How about 5 different medications that have terrible side effects that impact child brain development? It's it's this crazy conundrum that we're living with, that here's this benign plant that has been so vilified. And, people would say it is, we would rather have this patient do all this invasive stuff, and this may be last resort. And even then I'm still against it.
Yeah.
And what's really unfortunate, and what I tried to do at the last few conferences that I've been at, is look at the data, especially for CBD for epilepsy, and put out there what we know right now. And what we know right now is CBD is considered, at least within the scientific literature, and to those of us that know, a effective and safe anticonvulsant. And to still have neurologists saying, no, 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 we're going to try everything else first, you are losing time and you are losing brain function in a developing brain in these kids by allowing them to continue to have seizures, and also to try different medications that can have some serious side effects.
So this is also happening in Portugal, according to reports we have from a few families, that doctors still deny or still say that, no, your son with epilepsy or autism, they have no indication to take medical cannabis. Would you say these are the biggest challenges that you find in your practice, or are there any others that you face every day?
Well, I think right now the challenge is more so in the United States, that we've actually gotten to a turning point, at least in many places, not everywhere, because it's a large country and there's a lot of different pockets of thought. But most doctors are starting to come around to CBD in the United States. There's obviously those that will not and don't, but parents can change from this neurologist to this neurologist and bring it up. And what's happening, the problem is that now that there may be a family who's been kind of given the okay, go ahead and do it. But the doctor says, I don't know anything about it, I can't help you. So now they have to find a practitioner.
Yeah.
So that, and of course, I try to take on as many patients as I can, but I'm only one person. I'm trying to also educate other doctors, and I definitely see doctors starting to embrace this. So that's the good news. It's not all doom and gloom. But I think still in other countries, there's a little bit lag. The first patient I've treated with CBD was in 2013. Think about, that's almost 10 years.
Yeah.
And that child is thriving and doing great. I bring him up at all of my conferences and I say, here he is 9 years on cannabis oil, not just CBD. He also takes THC. He also takes THCA, and he's thriving in his life, absolutely thriving. Is it perfect? No. But when we think about where he might be, when we looked at the issues that he had back when he was 4 years old and started this. And, I'd like to just share something. I got an email the other day from a mother of a little boy with autism. And she said, I wanted to wait before emailing because I wanted to really pay attention to what's going on with my child and just make sure it really was the cannabis making a difference. And so here's a little boy who, when we introduce, he has autism, when we introduce CBD, behaviors got better, sleep got better. And then we introduced CBG, cannabigerol, and he started speaking.
Mm-hmm.
And then we introduced, the mother was so on board and saying, this is so great. Is there anything else?
Yeah.
We found a good dose. And remember, when you're finding a good dose, you want something, no side effects, you're maximizing benefits and minimizing side effects. And we added in CBDA, and she said his language just took off.
Yeah.
Now, I have to be honest, we don't know all the mechanisms of action.
Yeah.
But that hasn't stopped us from giving out all these kinds of pharmaceuticals.
Yeah.
My mother took a drug called Dilantin that's still to this day, nobody's really sure exactly how it works.
Yeah.
And it's still prescribed. So there is this kind of double standard with cannabis that we have to know everything about it. Again, going based on all this propaganda that wasn't true to begin with. And I think if we can identify that these compounds are medicinal, they're safe, they're effective, they're not perfect, but nothing is.
Yeah. And with cannabis classified as a Schedule I drug in the US, the research was shut down, and you say this in your book, for many years. We didn't research. You spoke just now about minor phytocannabinoids like CBG or CBDA that are not being so widely used yet. So how is the actual state of research with medicinal cannabis? What evidence do we have already, at least for the pediatric pathologies?
Well, so the state of research is very sad. Of course, there's funding issues, and then there's, trying to find the physicians who are interested in doing this research. And luckily around the world, there's a handful of researchers. So that's the good news again. But certainly we are behind in terms of all those years that we lost. So especially I think more for cancer than any other condition. Well, I should say also neurodegenerative disorders. It would be nice to know if someone on cannabis who might be at risk maybe can be preventive rather than waiting till after the signs of neurodegenerative disorder begin. But for autism, we have a decent base of knowledge in that there is evidence of endocannabinoid dysfunction and there is evidence of a response. And if you look at the scientific literature, it's all just in the last few years. So you can't look at from 20 years ago for autism and cannabis. It doesn't exist. This is all just in the last few years. For epilepsy, certainly, as I've mentioned already, there's no question CBD is considered a treatment. There is a pharmaceutical CBD grade out that's approved by the FDA in the United States. Of course, it's very expensive, excuse me, and there's just a handful of conditions, but it has been approved. And when you have the FDA approving it, we can say then that how do you approve one product and you're saying now, oh, we can't use the other products. It's just silly. They're the same. Very similar, I should say. And actually the natural seems to be even better because you have less side effects from the latest study. And in terms of other conditions, there's some cancer research being done. It's not on pediatric patients, but like breast cancer is a big focus. And certain brain tumors are a big focus right now. Certain research groups looking at cannabis, but certainly not enough research. And it's going to take years and years for us to know everything. And again, botanical medicine, whole plant compounds, still in that natural whole plant state, very difficult to study because it's hard to know what compound is doing what. It doesn't really fit the pharmaceutical model, which is we have one drug, one chemical structure that we're going to study. Very hard to study botanical medicine in the same way.
So what you do in your practice is more like an empiric approach to your patients. If CBD doesn't work, then you might try CBDA. Is that correct?
Yes. And even let's say CBD does work, but it doesn't give the full treatment that we're looking for. Because what I say is with each patient, I have to find the best response to a compound. And sometimes there's no response. Sometimes it's a partial response, and sometimes it's a perfect response. And so I have found that combination cannabinoids can really be tremendous for people who have chronic conditions, especially children with epilepsy or children with autism, where a combination of CBD and CBG may be working, or CBD and CBDA, or CBD and THC. I mean, almost the combinations and dosing is endless. The dosing is titrated, not a specific dose. So like in the medical world, we're told, okay, this is the dosing between this and this. But in the botanical medicine world, you really want to start with a low dose and titrate up. It can be tedious. You have to have patience to find what works. For someone to just say, oh, you should take this product at this dose right out of the gate. I mean, you could get lucky, but that's unusual.
Yeah.
And yeah, so it is somewhat empiric, and it is individualized, and or you could say personalized or customized, because despite checking the same box for a medical condition or diagnosis, remember the endocannabinoid system is kind of functioning on a very cellular level.
Yeah.
So, and on a cellular level, we're all very different in the way we metabolize and absorb and utilize different compounds, and we have to respect that.
Yeah. As a doctor, how do you advise your patients to start taking CBD, for instance? Because we know that is safe. The side effects are not severe per se, so to speak. So, but many people in Portugal, for instance, they are trying CBD, moms on their kids with epilepsy, with autism. What would you recommend for them to do? Because some will take CBD for 2 or 3 weeks, doesn't work, and they say, oh no, CBD doesn't work.
Right.
But it's not actually like that, isn't it?
That's right. Dosing.
Yeah.
And what we know about CBD for epilepsy, especially, or CBD for autism, is that there's going to be patients that respond at the very low end of dosing, and there's going to be those patients that require the high end. How do you know who you are? You start low, you titrate up. In general, for pediatric epilepsy, we start at about 1 milligram per kilo per day of CBD. So you take the weight in kilos, multiply it by 1 milligram per kilo per day, and you end up with a number. So let's say a 25 kilo child would take 25 kilos times 25 milligram per kilo per day is 25 milligrams a day. And you try that for a few weeks, and then you go to 2 milligrams per kilo per day, and then 3 milligrams. And I know it's tedious, but that's the way it works. For epilepsy, I have found with botanical medicine, the range of dosing that is effective, somewhere between 5 and 25 milligram per kilo per day. And what I want to point out about this is that that's what we call a very wide therapeutic range. And again, there's going to be children at one end, and there's going to be children all the way at the other end. So dosing matters. I cannot tell you how many people have come into my office and said, oh, we've already tried CBD, it doesn't work. And then I calculate out, and they've gone as high as 2 milligram per kilo per day. That's not even at the low end of the therapeutic range. They didn't even get in.
Yeah.
And what you have to realize is that depending on the oil you're using, let's say you're using an oil that's not very concentrated, it may look like a large volume of oil. Well, I'm giving my child so much. But if it's not concentrated, I mean, if it doesn't have a lot of milligrams in there, then you're not going to be able to titrate up, because a child can't drink a whole bottle of oil. And I always say this, that there's a company that recently put out some new oil, and it's 500 milligrams in the bottle. Okay. If your dose per day is 250 milligrams, which is not unusual for a child with epilepsy, that's 2 doses in that bottle. That is not the proper product. There are products that have 3,000 milligrams in the bottle, or 5,000 milligrams in the bottle. I even just saw a product with capsules that are 200 milligram capsules. So if for a teenager who's taking 600 milligrams a day, that's easy. That's 3 capsules. So I always tell people you have to separate like how much it looks like and what the dose is, because you could trick your brain a little bit to say that it seems like so much. It's
Mhm.
not so much sometimes. So that wide range of dosing is very important. And then one other thing to mention is, of course, drug interactions. The latest studies, when I first started doing this in 2013, we were very careful about the drugs and even going slower than 1 milligram per kilo per day increments. We know now clobazam is one of the drugs you have to be careful with. It's not dangerous, but it can
Mhm.
cause a lot of sedation. And
Yeah.
also Depakote or valproic acid, you have to be careful with, because that drug can have an interaction with the liver. And so it's important to follow blood tests that look at liver function. But other than that, in general, it's pretty safe. Now, I do highly recommend that you have some medical supervision when
Mhm.
you're doing this, especially with a child who has chronic conditions,
Mhm.
just because oversight is good so that you're not so fearful and you're not, again, do no harm.
Mhm.
But, we know that that's difficult because there aren't that many practitioners doing this.
Yeah. You also mentioned that parents, they shouldn't use like the dropper. They should use like a 1 milliliter syringe, so the doses can be, all these milligrams can be accurate. How does it work?
That's true. The eyedroppers, depending on the size of them, can, some are tiny and some are big, so it may not be accurate dosing. Now,
Mhm.
the reality is too, is that with cannabis medicine, usually with a product that is good, and meaning good, what do I mean by that? Like reliable month to month and tested on a regular basis. Most of these products only have a variance of about 10 to 20%. So if the bottle, let's say, says 100 milligrams in 1 milliliter, it may
Mhm.
have some variance. It might be a little bit over, a little bit under, but still, we don't want something that's labeled 100 milligrams per ml. And then when you go to test it, it comes out 22 milligrams, right? That's way off. So it really should be something, a product that's semi-accurate. So what we call the certificate of analysis is very important. But
Yeah.
that being said, then once you're measuring the oil, I do recommend using a syringe, 1 ml syringe or a 3 ml syringe if you're measuring larger volumes, to make sure that you are accurate, because with a dropper, you're eyeballing it. And once you find the dose, let's say you find a dose that works, you want to be able to repeat that over and over. And
Mhm.
additionally, the reason we say milligram per kilo per day is you want to make sure that your child doesn't outgrow the dose. Because remember, children are growing. I call them moving targets.
Mhm.
So they're always changing and growing.
Yeah.
And the dose that worked before, your child may outgrow. They could gain 5 or 10 pounds.
Yeah.
And then start having seizures. So it's always good to know how many milligram per kilo per day, so that should they gain weight, you can recalculate up the dose to compensate for that weight gain.
Mhm. And you also mentioned the weeks for the treatment. They should do this, increasing the doses up to 10 weeks, right? Of treatment at least.
Well, I just say take whatever time you need to get your
Yeah.
child to, to max out the dose, right? So go to the 20 milligram per kilo. And look, the latest numbers look like somewhere around 80% of children will have some seizure reduction
Mhm.
from trying CBD. About 10% can look forward to finding seizure freedom,
Mhm.
which is,
Yeah.
remember, in this group of children who are told you will never be seizure free, that's pretty impressive.
Yeah.
And then about 4 to 5% may even have worsening of symptoms.
Yeah.
And then there's this percentage around 10, 15% for which it doesn't seem to do anything. And we
Mhm.
still yet don't know why it doesn't work for some people. Is it an absorption issue? Is it a cellular issue, metabolism issue? We don't know yet.
Mhm.
But those numbers are pretty good. In fact, there was a report just in June of 2022 that came out of Israel that reported 73% of patients, and it's a small group, under 100 children, but around 73% had some evidence of a reduction of seizures.
Yeah.
And almost 60% had a greater than 50% reduction of seizures, and side effects minor, well
Yes.
tolerated. I mean, talk about a good medicine. What's interesting too in their report is they didn't find that the type of seizure or what caused the type of cause of seizure. So let's say a child is born with a brain malformation, or a child
Mhm.
has a genetic disorder that causes seizures, or for the children that we call cryptogenic, we don't know why they have seizures, or their age or their sex. None of that was related to the response. So I have had patients here and there who said, my neurologist didn't want me to use this because they said it doesn't work for my kind of seizure. Well, now the research is kind of showing it doesn't matter. And that and what I see in a way is, again, very benign medicine, very safe, especially under medical supervision. In a child, you've tried 2 or 3 different drugs, it is time to try CBD. There is no reason that this should be 15th on the list, because we also know that after the first few drugs, if you're not getting any benefit, you're very unlikely to, based on the odds.
And probably will get worse with the side effects, the long-term side effects.
You certainly could, and you can certainly have the stacking of drugs, which is I see happening all the time, that the children on multiple medications, and then that compounds also the side effects.
Mm-hmm. What about, I remember you mentioned in Australia, they did a study with minor cannabinoids for, was it Rett syndrome, a form of epilepsy?
That's right. So Rett syndrome is a genetic form of pediatric epilepsy, has multiple other issues, developmental abnormalities, and some other issues as well, behavior issues, as well as seizure disorders. And they did a study on CBDV, cannabidivarin, and they started with 2.5 milligram per kilo per day and titrated up to max dose that they used was 10 milligram per kilo per day, based on some reports of sedation. Although remember that not everybody's going to get that, you could go higher. And what they saw was some very nice results with something like 75% reduction of seizure. And it was a small group, only 5 patients. It is a rare disorder, but I have a handful of kids in my practice with Rett, and we've added in CBDV in addition to some of the other compounds. And not only are the parents reporting seizure reduction, but they're also reporting some benefits in terms of behavior, in terms of motor skills, and in terms of neurocognition.
Yeah. Bonni, what are the main pathologies that you treat your kids? What do they have mostly?
So often they are the worst of the worst. They've tried everything under the sun, even have had brain surgery, sometimes before they come see me. So epilepsy, autism, often the dual diagnosis, there's an overlap. I see patients with GI disorders like Crohn's disease, ulcerative colitis. I have patients with anxiety, depression, borderline personality, especially some teenagers that are really struggling. Also, one of the big diagnoses I see is pediatric cancer. Many of the cancers that I see, of course, are those where the patient doesn't have a clear path to remission, and it doesn't look good for them. And what we know is that cannabis seems to be quite safe when combined with chemotherapy and radiation, even may enhance those other modalities. Some evidence that CBD may make cells more, cancer cells more susceptible to those treatments. However, we have some preliminary evidence out of Israel that cannabis plus immunotherapy is probably not a good combination. Immunotherapy means that the treatment doesn't go directly to the cancer. It is actually altering your immune system to attack the cancer.
Okay.
Because that is our first line of defense, is that we have an immune system that's supposed to help us defend against cancer. And I think it's fairly well known now that many people who develop cancer, their immune system failed them in some way. That's why it's so important to take good care of yourself with exercise and eating well, and don't put chemicals in your body, because you want your immune system to be there for you. This evidence from Israel with medical cannabis and immunotherapy combination, and again, it's preliminary, but it is very telling in that that the endocannabinoid system is highly dense in your immune system. And when you use cannabis, you are altering your immune system through the endocannabinoid system, right? Immunotherapy is altering your immune system. And that combination in one particular study actually showed much poorer outcomes for people on both. During immunotherapy treatment for cancer, meaning they had a shorter survival. So we certainly, and there's interesting research that came out of Germany looking at people in palliative hospice type care who took THC. They actually had what looked like extension of life. And so we certainly don't want cannabis to shorten somebody's life because you're taking it thinking that it's going to help you fight cancer or the side effects of the treatment, but you're also on immunotherapy, and that combination is kind of wiping out your immune system. We don't want to see that. So anybody who's using cannabis during cancer treatment should certainly be at least asking questions and making sure they're running through the research. And also, I don't like the blanket statement, you shouldn't use it if during immunotherapy. It should case by case, but you need to be aware of that.
What about THC for kids? Do any of your kids use THC?
So many of my pediatric patients use THC. So again, it's very important to understand the science and not go back to the propaganda that it's damaging their brain. We have a compound in our body called anandamide that's part of our endocannabinoid system. The role of anandamide is that it is made on demand when we need it because we have been tipped out of balance somewhere, whether it's our immune system or our chemical messages being sent in our brain for anxiety and pain and nausea. Anandamide is released, the body recognizes, oop, we're having a physiologic stressor. Let's put out some anandamide to help minimize that stress and maintain that homeostasis, that balance. And that's the job of the endocannabinoid system. In one sentence, is to keep homeostasis to any internal or external triggers that tip us over a little bit, that challenge us. Our endocannabinoid system comes in and balances out. What mimics anandamide is THC. And we know this from Dr. Meshulam and all of this research. Well, it turns out that there's a couple of studies, very good studies, by the way, that report that children with autism may have a deficiency or were shown to have a deficiency in these studies of anandamide. So here we know they're missing a chemical that is needed to maintain physiologic homeostasis, meaning all the chemical balances in your body you want to maintain evenly. Well, no wonder they have self-injurious behavior. No wonder they are aggressive, or they can't sleep, or they cry or scream all day in pain. They're in an imbalance, and drugging them with pharmaceuticals does not address that underlying cause. So how do we fix that? Well, we can use CBD, because CBD will interact, but for many of them, about 50%, CBD is not all that helpful. But when you give them non-impairing doses of THC, it provides them with that augmentation of the endocannabinoid system, kind of like an anandamide replacement treatment to help get them back into balance. So when I have a parent who says, my child is doing so well, they leave in the morning, I give them a little CBD and a little THC, and they go to school and they have the best day. And then around 1:30, the behaviors pop out. What's happening? It's wearing off, and they're going back to that baseline, back to that deficiency. And so this idea that THC is bad for the developmental brain is just nonsense. It's whose brain are you putting it into? If the brain isn't having any issues, okay, I'm all good with that. Don't give THC. But when there is a clear imbalance, especially in a condition where we have evidence of an anandamide deficiency or endocannabinoid dysfunction, of course you would want to try to include THC, because CBD does not do the same thing.
And to have these accurate results and knowledge about your patients, you also have to rely on on the parents' feedback. How do you work together with parents to, to follow up with your patients?
So in the beginning, what I tell the parents, so let's say it's a new patient, we spend about an hour and a half together, and then I give them my email and I tell them, put me on your calendar for either a once a week or once every 2-week check-in. Email, this is what my child is taking, and this is what I have seen. This is invaluable information because, first of all, I don't like putting a child on a medicine and saying, see you in 3 months. That is a complete waste when you're talking about cannabis because we start low, we have to titrate up. I would never leave a child on a low dose for 3 months. What a waste of money for the oil, right? Or for the medicine. The family, and I tell every family, if you contact me at least every week or every 2 weeks, we will get somewhere. We will rule it in or rule it out. And I talk about that in my book. When you rule something in, that means it's working and we have found a dose. But that takes time. How do you know it's a good dose? The only way to know is to get to that dose. And sometimes you have to pass it up and then go back. Oh, whoop, now he's so sleepy. Okay, back up. It was 1 ml, let's say, is the dose. 1.2 ml was too much. Okay, so now we're here at this dose. Let's leave him there and get a real understanding, a couple of weeks of baseline. Because you have to remember that botanical medicines are not harsh and heavy. They nudge you in the right direction over time. I liken it to like working out. If I'm out of shape, I don't get in shape tomorrow because I went to the gym or in 3 days. I have to, start doing it on a regular basis, allow my body to slowly change in response to this. And usually by 2 or 3 months, you start to really see some benefit. And, it's interesting too, Laura, this handful of studies now showing that the longer you stay on cannabis, the better your results are. Which is really fascinating. There was a study that came out, I want to say 2021, that looked at assessed seizure reduction in both children and adults at the 1 month mark, the 1 year mark, and the 2 year mark. And those patients who responded had better results the longer they were on it. So giving up early is not a good idea. Right. I understand you can be frustrated, especially when you're paying out of pocket for something. But you have to give it time. Even there's studies on, there's a study on Parkinson's, adults with Parkinson's, and those who hung in there for 12 weeks had very good, decent results compared to, 5 weeks in and assessing. It's just not enough time. You have to give, this is plants. You have to give the plants a chance to change the chemistry.
So, but what can parents do with doctors when they try to explain something to them and they say, oh, you're not a doctor, but they are every day with their kids, so they know them better than anyone.
So I have never said that to a parent. I get doctors being frustrated that somebody's coming to them and asking about something they don't know about. But one of my kind of accomplishments I would like in my life before I leave this world is to at least leave behind a legacy of, you have to be able to have a conversation about this with your patients. Even if you're not the one prescribing it, you have to have a conversation. What does that mean? That means read my book, go into the scientific literature, and just even look for the last 2 or 3 years. You don't have to go all the way back to the beginning. You already know your specialty. Now just add in a little bit about cannabis. And so that you can at least understand, what is the chance of a child with epilepsy who has not responded to other medicine? What is the chance of them responding to CBD? You should know the answer to that question. And the answer to that question is somewhere between probably 75 and 85% chance that they're going to have some reduction of seizures. That alone should drive you to say that this is reasonable medicine, especially since, and I have seen this, doctors being hypocritical and saying, well, we don't know long-term. I have seen letters from doctors written to insurance companies saying, I know this drug isn't studied in pediatrics, but I want this patient I want you to pay for this drug for this child, at least as nothing else has worked. Can we at least try this and will you pay for it?